So today also we will continue with our exploration of Nidana. There is one chapter in Ashtanga Sangraham Sutrasthanam called Roga Bhediyam. Roga Bhediyam, which is a very important chapter as far as the understanding of Ayurveda regarding the Roga, Vibhajanam, Roga, Samprapti, all these things are concerned. And that chapter opens with a sort of division of vikaras or rogas. The very beginning itself is with that statement, Roga Bhediyam, how the rogas are becoming different. That is the very meaning of the chapter's name itself, Roga Bhediyam. So it is a chapter which discusses with the Roga Bhedas, different categories of rogas. And the opening statement goes like this. What is that? Saptavidhaha ghalu roga bhavandi. Saptavidhaha ghalu rogaha bhavandi. The same concept is discussed by Sushrudacharya in a different mode. It is there, but I think I prefer rather to discuss this Ashtanga Sangraha Bhedam, because that makes more easy learning. What is that Saptavidha Ghalu Roga Bhavandi? This sevenfold classification is based on some understanding of the Nidana. How the Vyadhis can be categorized based on some sort of understanding of Nidana. That is the important. That is why we are taking that point here to discuss. What is that? Saha garbha jata pida kala prabhava swabhavajaha. That is a sevenfold classification. Saha garbha jata pida kala prabhava swabhavajaha. So jaha, prabhava jaha, jaha janitaha. So saha jam, that ja is to be appended with all those padams. Saha ja, sahajaha. Garbhaja, garbhaja vyadhi. Jadaja vyadhi. Pida kritam, pida kritam, pida jam, pida kritam. Kala jam. Then Prabhavajam, Swabhavajam. So this is not like a sevenfold watertight compartmentalizing of the Vyadhis. There may be mixing. Between these seven categories, there can be items which come in two categories or three categories simultaneously. That doesn't matter. But this sort of an understanding is essential while we understand a Vyadhi. So this is important, and we will see what are the criteria on which this classification is made, or how far it is relevant in the clinical methodology of Ayurveda. That is what we will be seeing. And as I mentioned earlier, fundamentally, this is a classification based on Jam. So the source of origin. So that is some sort of a Nidana based classification of Vikaras. So Sahajam, Garbhajam, Jadajam, Pidakridam, Kalajam, Prabhavajam, and Swabhavajam. These are the divisions. Then Sahajam. What is Sahajam? Sahajaha Shuklartavadoshanvayaha. Sahajaha Shuklartavadoshanvayaha. They are caused because of Shukla dosham and Artava dosham. So there are some diseases which are caused by Shukla dosham and Artava dosham. So in effect, Purusha bija doshajam and Stri bija doshajam. Shuklam as a whole represents the Purusha bijam, or the paternal half of the person, and Artavam represents the maternal half of the person. So here we find Shukla Artava doshanvayaha sahajaha. So in any case, whatever the case may be, we should look for, is there an sahaja element behind this vyadhi? And certain examples are given in the text. What are they? Kushtarsho mehadayaha. Kushta arsho mehadayaha. So Kushta arsha and meha adayaha, etc., etc. So these are some examples given in this regard, as the diseases which can have Shukla doshanvayam and Artava doshanvayam, or Shukla dosham or Artava dosham behind it. We have learned in Sharirasthanam various types of Shukla dosham and Artava dosham. Vadadi Kunabhagrandhi Puyakshina Malakvayam Vada Samartham Redosram. At one point, this is, fortunately, they are that Bija Samartham. They are Bija Samartham. There is no offspring as long as it is not corrected. But there are some other things where the Bijam will be there, Garbham will be there, but there will be Bija Bhaga Dushti, which is transferred across to the new generation. That can happen. So it comes under the Sahaja Vyadhi. In Arshas, there is a special reference in this regard. Sahajani. They are Vali Bijopataptitaha. They are caused by the Bija Bhaga Dushti corresponding to the Gudavali. Vali Bijopataptata Saptataha. Then, so they are definitely that is going to affect the Sadhya Asadhyani. Evamakhyadah sarve roga kulodbhavaha. So there can be kulodbhava vyadhis as well in this category. Kulodbhava vyadhi. Because this Shukra dosham, that Bija Bhaga dosham or Artava dosham, that means the Stri Bija Bhaga dosham, can be running in the family. That can happen. Then it is not just Sahajam, but it is Kulajam as well. Sahajam, which goes one step deep to make it Kulajam. So two possibilities. It can be Kulajam, which runs in the family. That also should be looked into. Sometimes it can be Sahajam, that is something like a sporadic concept from particular level. From that level onwards, it starts. You can't see it behind in the Kulam. So both these possibilities are to be looked. Sometimes we find that somebody who is born to a Pramehi, that is going to affect the Sadhyada. So these type of classification we are meeting with every day in our everyday practice, but we sometimes overlook it. We do not take sufficient care of that issues. So it should be taken into consideration as a important classification based on Nidana, that is Sahajam. And this is divided into Pidrujam and Madrujam, which we already discussed. Pidrujam and Madrujam. Then next is Garbhajaha. That is the second classification. Saha Garbha. Garbhaja Vyadhis, very important again. Now it has become a evolving branch actually. What is Garbhajam? Garbhajam Janani Apacharad. Garbhajam Janani Apacharad, caused by the apachara of Janani, Mother Mata. So Janani Apacharad, apacharam, some sort of a karma bhramsham, achara bhramsham, sheela bhramsham, all these things can be included. Some sort of a hina mithya adi yogam of karma of various types. Janani apajarad. Here also we find some examples. What are the examples given? Kaujya, paingalya, kilasadayah. There are some examples. Kaujyam, some sort of a deformity. Paingalyam, again some sort of a problem with the skin. Kilasam, again the same thing. So kaujya paingalya kilasadayah jananyapajarad garbhajaha. And it is divided into two. What is that? Annarasajaha, Dauhrida Vimanajaha. Certain types of jananyapajaram may be related to the consumption of food. So they come under the category called Annarasajaha. Sometimes they may be related to the Dauhrida Vimanam. Dauhrida Vimanajaha cha. So now this has become a new branch called epigenetics. It is epigenetics. Of course, you can't say that, okay, Ayurveda is dealing with epigenetics because it is a technical term, because they are looking into the changes that happening in the gene level because of the Jananyapacharam, the environment in which the fetus is growing, internal as well as external. So, but the idea is same, but the description is in a different context and a different style, but idea is same. So that is coming under Garbhajam. So again, this is also going to influence the Sadhya Sadhyada, and also the intervention should be designed accordingly. So in any case, we should look for, especially in childhood disorders, because that it is at that point of time that they are going to be identified for the first time. So whether there is a Jananyapacharaja factor is there. It is, if it is there, it is coming under the classification of this is a Garbhaja Vyadhi. That is also a relevant point to understand. Then the third one is Jadajam. Jadajam. Jadaha. It is born. The child is born. Then now onwards, his own activities or her own activities is going to create the problem. So it is coming under Swapajarad. It is Swapajarad, by one's own apacharam. Jadajaha Swapacharad, and they are broadly divided into the idea behind Vividho Vakramaniyam, Upakramyasya hi dvitvad, Dvidhaivopakramo madaha, Egas Sandarpanaha tatra, Dvidiyaschapatarpanaha. So that Sandarpanajaha, Apatarpanajaha cha, that is the twofold division that is possible with a Jadaja Vyadhi. And this is the most commonly encountered Vikara Vibhajanam. The most commonly practiced classification of Vikara is based on this Sandarpanajaha, Avadarpanajaha cha. They are Jadajaha. Jadajaha. So sometimes there may be overlapping, which we have to look at once we complete the sevenfold classification. So Sandarpanaja Vyadhi, Apadarpanaja Vyadhi, that is Jadajam. Then the fourth one, Pidakritam. It is about Pidakritam. What is Pida? Pida is trauma. Pida is trauma. So what is the explanation given for the Pidakrita Vyadhi? It goes like this. Pidakritaha Kshadabhanga Prahara Krodha Shoga Bhayadayaha. So that is one line. Kshadabhanga Prahara Krodha Shoga Bhayadayaha. There is no division given as such, but you can draw a line in between. the first three and the remaining three. And Adayaha can contribute to both the first and second half. What is the first half of three? Kshada, Bhanga, Prahara. What is the second half with three? Krodha, Shoga, Bhaya, Adayaha. Adayaha can contribute to both the first and second halves. So what is happening? Pida is the trauma, traumatic, and it comes under Kshada, Bhanga, Prahara, which is physical trauma. Then Krodha, Shoga, Bhayadayaha, which is mental trauma. So traumatic issues or diseases which come under two: physical trauma, mental trauma. That is also an important classification based on the Nidana factor. And physical trauma is somewhat easy to identify and intervene, whereas mental trauma need not be like that. Many a times they may not, the individual need not disclose it. But in spite of the best of the exploration, if you fail to identify the physical cause behind the Vyadhi, you will have to look at the mental cause, possibility of the mental cause playing behind the manifestation. So this idea is explained in a different context by the name Aganduja Vikaraha. Aganduja, we will come to that because it is a different classification. So Aganduja Vikara in general is dealing about traumatic type of diseases, which has got a twofold classification, physical and mental. We will come to it in little bit detail later. So this obviously, I think certain points we have to recollect. What is that? These presentations may overlap. The Shariraja Pidakritam and Manasa Pidakrita Vikaras may overlap. So sometimes the presentation may be quite complex and which is very difficult to figure out, because the Adharadheya Bhavena Manas Sharirayottabaha Parasparam Abhivrajed. Manas Sharirayoho Tabaha Vikaraha. Manas Sharirayoho Vikara Parasparam Abhivrajed. They may overlap between them. Adharadheya Bhavena. That is very famous. And this is actually the physician or the clinician who is able to look into the finer aspects of these sort of issues. Actually, they win in their clinical practice much better than those who are not accustomed with this information and those who do not give proper care to these points. So this is actually the difference between a normal clinician and an intelligent clinician, is that the intelligent clinician invests more time to gather the finer aspects of the vikara. There is a gross aspect of the vikara and the finer aspects of the vikara. An intelligent physician, especially in chronic diseases, spends or invests more time to look into the finer aspects, which will include the physical and mental details with all available nuances. So that is the difference between a normal physician, a sadharana vaidyaha, and a apurva vaidyaha, or a asadharana vaidyaha. So these things, manas sharirayottabha, and at one point it is told by many acharyas. At one point, Vakbhada as well as Charaka highlights that idea. What is that? Aganduranvedi nijam vikaram nijastadhagandum adipravruddhaha. So you will not be able to figure out which is the Swadandra, which is the Paratandra, which is the Anubandhi, which is the Anubandha. So that is what I'm saying. The intelligent physician is one who is able to figure out these sort of the finer threads that is interwoven in the total picture of the disease manifestation. So we should put extra effort. We should invest more time to understand these sort of aspects. At one point, we again see Jnana Buddhi Pradipena Yona Visadi Yogi Vadu Adurasya Andaratmana. Only those Vaidyas who succeed to get into the Andaratmanam of the Atura. Actually, he is the winner. He is the real Vaidya. So we should put all our efforts to identify the vikaras in terms of this sort of nidanas. Then the next classification is about kalajam, kalaja vikara or kalaja roga. And kalam, we all know, kalam is that Shidoshna Vrishti Bhedad Trudha. And that is the meaning here also, kalajam. Shidadi Kridaha, Shida, Ushna, Varsha. Kalajaha, Shidadi Kridaha, Jvaradayaha. Even there may be some mental aspects as well. That also should be taken into consideration. There are many people who goes to who dip themselves into levels of depression and anxiety when there is drastic changes which is setting in immediately in the environment. That is also a possibility. So it is not just about the Jaradaya, but it is also about this mental aspects as well. So Shidadikritaha Jvaradayaha Kalajaha. Shidadikritaha Jvaradayaha Kalajaha. And it is divided into, again, like the other classification, into two. Vyapannajaha Asamrakshanajaha cha. Vyapannajaha Asamrakshanajaha. Vyapannajaha. What is the meaning of Vyapannaja? Ridu Vyapat. Ritu Vyapat is a possibility, which has become not a possibility, it is a reality. These days, Ritu Vyapat is a reality, and that is changing the disease pattern completely all over the world. It is a reality, it is not a possibility, or it is not an imaginary question. It is a reality where we are living in. And asamrakshanajaha, that is where the Vaidya should get an upper hand, even in the purview of public health. That is a hidden weapon, actually, but we do not know that it is a weapon. We are just sleeping over it. This asamrakshanajaha. What is that asamrakshanajaha? Asamrakshanajaha means the kalaja vikaras which are manifested just because proper Ridhucharya was not followed. By the negligence of the concerned person in following Ridhucharya, the vikaras which are the result of the influence of Kala, they are coming into the fore. They are called asamrakshanaja kalaja vikaras. The influence of Kala in the disease manifestation is well documented all across the textbooks. At one point we find Kale yadhaswam sarvesham pravrittihi. In Jvara, Kale yadhaswam sarvesham pravrittihi vruddhireva va. Kale yadhaswam sarvesham pravrittihi vruddhireva va. That is possible. Then at one point we find Sharat Kala Swabhavacha Shonidam Sampradushyadi. Sharat Kala Swabhavad. It is Kalajam. Sharat Kala Swabhavacha Shonidam Sampradushyadi. But what should be done? Ridhucharya should be followed. Then it can be avoided. So it was not followed, and Shonida Dushti happened, and Vikara manifested. Then it is a that asamrakshanaja kalaja vikara. The Ritucharyas were not followed. In Roganulpadniyam, we find very beautiful descriptions in order to avoid the potential nidanas which can cause the vikaras. It is a beautiful Shidodbhavam doshachayam vasande Vishodhayan grishmajam abhrakale Ghanatyaye varshigam Ashu samyag that prapnodhi rogan rudujan na jaduhu. It is explained. Rudujan vikaran na prapnodi. So it is there. So when it is not followed, you get with the kalaja vikaras, and then it is called asamrakshanaja kalaja vikara. Then next division is prabhavajam. Prabhavajam. Prabhavajam is again a very important classification. Here we find Deva Guru Langhana, Shapa Adharvanadi Kritaha. Deva Guru Langhana, Shapa Adharvanadi Kritaha, Jvaradayaha Pishajadayascha. Again, it has got a twofold classification, Jvaradayaha Pishajadayascha. The cause here is Devulanghanam, Gurulanghanam, Ullanghanam, act against the advice of, act against the wish of, or against completely Deva and Guru, etc., etc. Then Shapam, Abhishapam, then Adharvanam, it is Abhicharam. In Agandu Jwara, we find this division, isn't it? That Agandur Abhighada Abhishanga Shapa Abhicharataha Abhishapam Abhicharam. There are two divisions we find that. So actually they are coming under some sort of a Aganduja Vikara, but the element of Prabhava is very important, and they are called Prabhavaja Vikaras. It can be two types. Shariram, Manasam. Shariram is explained with the Jvaradayaha. Manasam is explained with the Pishajadayaha. Of course, there may be multiple attitudes which needs deeper discussion in this regard. Because ultimately, this is not about the evil forces which is acting around us, but it is about the way in which the mind is, the mental makeup is getting afflicted by certain actions, making the individual sick. Charaga, after explaining all the beautiful descriptions of Agundaja Unmada, he will conclude it with Atmanameva Manyeda Karanam Sugha Dukhayoho. It is not about the Pishaja, Deva, all these things, but it is about the weak mentality, weak mental makeup that we have to blame at. But anyway, these are all part of the deep belief systems which is prevailing in the society. So the explanation also goes in that line. This is very important. Jvaradayaha, Pisajadayaha. And when somebody is afflicted by these sort of issues, initially I think some sort of a Dhidhairyatmadi Vijnanam, all these things may work, but at one point it may require very elaborate treatments. This sort of Dhidhairyatmadi Vijnanam will not be sufficient. So we have got another branch called Deva Vipasraya Chikitsa. So whether to go for Deva Vipasraya Chikitsa or not is based on this idea, whether it is a Prabhavaja Vikara or not. So the selection of the treatment or an add-on principle of certain treatments to the main treatment is made based on the Nidana. If it is a Prabhavaja Vikara, you will have to look into these options. In Jwara, we find actually it is more about the area where the affliction starts first. In Prabhavaja Vikara, especially in the Abhishapa Adharvanadi Kriyas, Tatra Abhijarigair Mandrair Huyamanasya Tapyade Purvam Chedaha. Purvam Chedaha Tapyade. First, the mind is becoming warm and hot with fever. Tado Dehaha. Then only the body is becoming hot and warm with fever. So the first manifestation is about the fear or the anxiety or that element which is going to negatively influence the confidence level of the person, then at that point itself he has become sick. Whether the jwara has manifested or not is a different question. That is going to manifest. It is just a matter of time. At that point itself, where that confidence is down, that point itself, the person has fallen sick. Then the things are becoming complicated. Then the last division is swabhavaja. Swabhavaja vikara. Swabhavajam. It's a part of swabhava. Swabhava. It is a nature. What is that? Chut pipasa jaradayaha. Chut. Chut. Pipasa. Pipasa. Jara. Jara is aging. So chut pipasa jaradayaha swabhavajaha. Then it has also got a twofold classification, that is kalajaha, akalajaha. So when chut happens in the kala, it is a kalaja vikaram. Then why should it call a vikaram? If left unattended, it is going to make the health, bring the health status down. So that is why it is to be attended, and it is named as a vikara. Pipasa, same thing. When it is kalajam, why should we call it as a vikaram? It should be attended. If left unattended, it is going to harm the person in terms of the health status. Jara, jaradayaha, kalajam, akalajam. Kalaja jara is fine, but you can delay it. If you do not attend it, it is going to harm you. So there is rasayana chikitsa. When to be done? Purve vayasi madhyeva, not at the end. Purve vayasi madhyeva. Then akalajaha, in the very beginning itself. Chut, in the untimely. Vibhasa, untimely. Jara, untimely. These are going to be the akalaja swabhavaja vikara. It is anyway it is going to come, so swabhavajam, but akalajam, untimely. And this is again divided into rakshana kritaha, arakshana kritaha. Rakshana kritaha means they came in spite of proper care. Whereas arakshanajaha, they came because of carelessness. It was not attended properly, so they came. So arakshanajaha. So swabhavajaha, chut pibasa jaradayaha, kalajaha, agalajaha, tatra kalajaha rakshanakritaha, arakshanajaha, akalajaha. Akala chut, akala pipasa, akala jara are the outcome of arakshana, carelessness, not attended properly. So this sevenfold classification, sahagarbhajada pida kala prabhava swabhavajatvam of a vikara, will give the clinician better choices for intervention, precision in the intervention, and gives possibility of faster recovery, and giving the patient, the individual, a better idea about the sadhya sadhyata. So this is highlighting the importance of understanding Nidana, and this makes our clinical decision making a bit sharper. So here we end today. We will meet again on Saturday morning. Then I conclude. Thank you very much and have a good day. Bhishajam sadhu vrittanam bhadram agamasalinam abhyasta karmanam bhadram bhadram bhadrabhilashinam.